You're listening to Chamber Chat on Chamber Channel 3. Chamber Chat is brought to you in part by Mansmith Pharmacy, where your care is our only concern.
This is Chamber Chat brought to you by Mansmith's Pharmacy, and I'm Deb Height. Today we're visiting with Peg McNally. Peg is the Community Public Health Director here at Palo Alto County Hospital. Welcome, Peg.
Thank you.
It's nice to have you here today.
I'm glad to be here. Is it about flu?
About flu, yes.
Yes.
It's fall and winter is just around the corner, and that brings on the influenza season. And so tell us what we need to do to prepare for that.
Well, we have flu vaccine available now in the county. It is available for anyone 6 months of age and older. So everyone that is of that age, which is pretty much anyone that's 6 months and older, should be getting a flu shot this fall. They are available at your provider in Palo Alto County if you go, and then we will be having some public clinics as well.
Okay. So is there a particular segment of the population who should be getting them? Just anybody, or is that more important for others?
The elderly are affected more with the influenza, and young children and young adults as well. That's kind of the category that was hit last year. A lot of young adults were hit with the flu. This year, there are 3 strains in our flu vaccine. They are the same 3 strains as last year. It's always picked by the CDC based on what happens in the southern hemisphere the 6 months before. So
that's interesting, the 6 months before. Okay, so are there different types of flu shots?
Yep. At the clinics, you can get the flu mist. We do not offer that at our public clinics, but at the family practice clinics, you may get the flu mist, which is available for those 2 to 49 years of age, and usually your insurance will pay for that. There's the injectable, which is available for anyone 6 months and older. This year we are offering for the 65 and older, there is called a 65 and older high-dose vaccine that is available, and we will be offering that at our public clinics. It is covered by Medicare, and it's only available for 65 and older. No one younger than that is it licensed for.
Okay, so what does the flu shot protect against?
The flu shot protects you against the respiratory flu. You know, lots of times you hear people say that they are throwing up and have diarrhea, and that is not what your flu shot protects you. It protects you against the respiratory. And symptoms of respiratory are the coughing, the sneezing, fever, chills, runny nose, fatigue, and that's what this shot protects you against.
Okay, so the regular 24-hour bug has nothing to do with this at all.
Right, and the shots are a dead virus, so you cannot get the flu from getting immunized with the flu vaccine. When you get a shot, it might be ironic that you get sick the next day because you got exposed to the flu sometime around the time or just before you got your flu shot. But you should not catch the actual flu from your flu shot.
Okay. Is there any time frame that's best to get it? Because I know people used to say, you know, if you got it, it only lasted like 3 months or something like that. So is that true?
The flu vaccine, no matter when you get it, the CDC, Centers for Disease Control, says you should get it as soon as it's available. It became available in August, and we now have it in the clinics and doing our public clinics. So as soon as it's available, get it, and it should last you through the flu season. There's no reason to get a booster or anything else next January and February when we have prime flu season.
Okay, so that was kind of a myth then, the fact that it only lasts 3 months. How about the children? Is there going to be some kind of a clinic in the schools this year?
There will be no clinics in the school this year. Last year we were fortunate enough to do that in all the Palo Alto schools. Thankfully, the Hospital Foundation gave us $23,000, which purchased the vaccine for all the school students in Palo Alto County. We do not have that funding available this year. It was a one-time thing, so we are not offering it. We will be having several evening clinics that we encourage parents to bring their children to. We have our routine immunization clinics that you can call our office and schedule your child. If your child's coming in for a routine immunization, they'll be offered the flu vaccine as well.
Okay, very good. So what are contact information for you for future clinics?
Okay, your future clinics, you can call 712-852-5419. That'd be the community health office. Or you can check our hospital website, www.pachs.com.
Okay, well, we thank you for being with us here today, Peg. Is there anything else you want to add at the last minute?
Just as the flu season is approaching, just to remind people, if you're sick, stay at home. Don't take your symptoms to work with you or send your child to school if they're sick. It's best because it's easily spread. It's best if you stay home if you're ill. Just always remember the standard: wash your hands, wash your hands, wash your hands, cover your cough, and make sure the Kleenexes get in the wastebasket as soon as they're used.
Okay, awesome. We want to thank Peg for being with us today. We want to encourage you to protect yourself against the influenza this season by getting your flu shot. This has been Chamber Chat, brought to you by Mansmith's Pharmacy, where your care is their only concern. Thanks for joining us.
This has been Chamber Chat on Chamber Channel 3. Chamber Chat has been brought to you by Mansmith Pharmacy.